Welcome to the Team Teach podcast. I'm Clare, and in each episode you'll find me talking with an expert guest to learn more about behaviour. We squeeze a lot into each episode. You'll listen to the latest thinking in behaviour, continue your professional development with our book recommendation, and then I'll send you away with 3 practical tips you can use in your setting. I'm joined today by Haydn Mansell. Haydn holds a Bachelor of Psychology and Graduate Diploma in Education. He's also an Advanced Team Teach trainer and a Therapeutic Crisis Intervention Associate Trainer. Haydn was raised by his wonderful single mother and grew up having 2 siblings with complex developmental disabilities. In his professional career, he has carved out an extensive understanding of trauma, complex and challenging behaviour, developmental disabilities and education. Haydn is currently the acting principal of Albany Secondary Education Support Centre. And today, Haydn and I are talking about trauma-informed practices and maintaining boundaries. Enjoy the episode. Hi Haydn, how are you?
Yeah, good, thanks. Thanks for having me on.
No troubles at all. I think, I kind of was saying this to you off air, I think the topic that you've chosen today is one that is so helpful for practitioners because we're talking about trauma-informed approaches, but we're also linking that in with the idea of maintaining boundaries as well. It's such a big topic, trauma-informed practice, and I'm sure we'll have lots to say about it. But I wondered if you could just start with a quick line about who you are and your experience with this topic.
Sure. So I'm currently the acting principal at Albany Secondary Education Support Centre, and we're a school for high school age students with developmental disabilities, and often complex and challenging behavioural concerns. And we have a lot of students who have either comorbid trauma or trauma as well. So that's my current role. I've worked as a behaviour consultant previous to working here, right across the state, and had a lot to do with training other staff members in various trauma-informed approaches and approaches to de-escalation.
Yeah, lush. And we kind of talked off air as well, is that I'm pretty similar to you in having similar experiences around supporting behaviour and trauma-informed approaches. But I think it's really good for me to be transparent, is that although I know a lot about the topic, I really don't feel like I have all of the answers. I don't know if you feel similar on this topic because it's so big.
Yeah, no, I definitely feel like I don't have all the answers. I probably have more questions than answers.
Yeah.
Over the course of my career, there's been various sort of aha moments and then big progressions forward. Learning about trauma-informed practices was a pivotal moment in my career, and the skills that I gained from learning about it were really helpful in being able to improve outcomes for the young people that I've supported over the journey. But the further I've got into it and the more time and energy I've spent in this line of work, I've started to notice gaps and lots of complex circumstances that get presented to me where I'm actually not sure what the right path is. And that's really got me at a point where I'm really thinking quite broadly about where to next.
It's where to next is always the hardest question, isn't it? Where you're introspecting and reflecting on everything. I just wondered if you could do our reflective question. I think I'm very likely this morning to fluff it, I'm sure, saying the question, but what you wish you knew then that you know now about the topic.
Yeah. So I suppose I have a bit of a different take on that, whereas I don't really feel that way about things that I didn't know in the past. I've definitely made a lot of mistakes over my journey, and there's been lots of situations where information that I didn't have would have been helpful. But I see all of those moments in time as stepping stones to where I am now, and every little thing that's either gone wrong or not gone how I would have liked, or moments where I felt unprepared or didn't know what to do, they always spurred me on to upskill myself, find the answers, and do better the next time.
Mm.
So I'd be reluctant to change those moments in time because I'm a big believer in the journey sort of being a sequential thing. And I would wonder if you were to go back in time and change things, would you be in a different place? And would that be a good place?
Yeah, I love this answer. This is my favorite answer so far on the podcast. And I guess it's a philosophy as well around actually we learn from those mistakes, and that's where the growth, as you described it, happens. And I think as
Yeah.
reflective practitioners, we have to be like that with our trauma informed approaches. And I think I
Mm.
said this to you off air as well, that there are just so many approaches, right? And so many theories, ideas, training,
Mm.
and just so the listener knows that we're based in different countries. So I'm based in the UK and Haydn's in Australia, but I'm pretty certain there isn't a standardized kind of version of what a trauma informed approach is. There certainly isn't in the UK.
No, there isn't. There's lots of different programs and frameworks that we could access, and I've been fortunate enough to become equipped in several of those, but definitely not all of them. And it can be quite confusing. And even with the evidence-based recommendations, there's a lot of evidence-based recommendations, and they all pull from different evidence bases.
Hmm.
Um, and that can be really overwhelming. And sometimes the only way to really get a feel for what's going to work is to actually give something a try. And you might give something a try and it might be really helpful, or you might give something a try and realize it's not practical in your setting. So there is a degree of trial and error as much as we try to research and read up and speak to experts first. There's always probably going to be that degree of trial and error.
Get stuck in and do it and see what happens, but based
Yeah,
on the kind of the bigger picture. When we say that everyone can benefit from Team Teach training, we really do mean everyone. Our in-house training puts the emphasis on the unique needs of your setting and creates a consistent approach to behaviour across your entire organisation. Head over to the Team Teach website to find out more.
yeah.
I know lots of listeners will be experienced with trauma-informed approaches, but some might be quite new to the topic. So I do think it's worth giving a bit of a definition of what we mean by trauma-informed approaches.
Sure. So I guess in an education setting, it is to focus on the feelings and bodily sensations that a young person may have during their various stages of escalation.
Mm-hmm.
It's also referring to the fact that trauma in early childhood or at any point of life can actually make physical changes to the brain. If we think about the part of our brain that responds to threat, if you've experienced a lot of threat, that part of your brain becomes the most powerful part of your brain and almost your default. So a lot of the young people we work with who have had, really traumatic lives, that part of their brain is quite dominant, which makes them hypersensitive, often anxious, and constantly scanning for threat, but also probably misattributing threat where threat even isn't there. And the trauma-informed approach to support that would be empathy, active listening, validating emotions, restorative, collaborative problem solving, trying to help the young people identify how they're feeling, how they're not just feeling in their mind, but in their body.
Mm-hmm.
So when they're feeling threatened, they might feel panicked in their mind, but are their muscles tense? Is their heart beating faster? Are they sweaty? And if they're able to identify that, what can they then do when they identify that to try and regulate themselves and to try
Mm-hmm.
and cope and bring themselves back to a baseline? And that's different for everybody. Obviously, some people it might be breathing, some kids it might be blowing bubbles, but then a lot of the older kids that we work with, if you tell them to breathe or blow bubbles, they're probably going to say something not very nice to you. So for them, it might be something completely different. If we were to talk about all the different coping strategies I've helped young people come up with, we'd be here for a couple of hours and we wouldn't be done yet. Like there's a lot of variety. And as I'm sure you as your own person would have your coping strategies, they're probably different to mine. But yeah, in a nutshell, that's what a trauma-informed approach to behaviour support is in my setting, is
Yeah.
working with young people around those things.
Yeah, it's those coping strategies, but that empathy and understanding coupled within it. And I think sometimes in our services, it's hard sometimes for staff when they're seeing behavior in front of them that might be physical, it might be dangerous, it might be unkind, it could be, you know, various things. And sometimes it can be really difficult for staff to see beyond that, and that underneath it is all of this trauma and all of the bits that you talked about with that, you know, hypervigilance and, you know, lashing
Mm.
out because someone's already, you know, not regulated. And I suppose what I'm wondering is really what you brought to the podcast was a really interesting angle around having that empathy and understanding around some of those distressed behaviors, but also, I guess, the boundaries within it and how to maintain those boundaries, because it is hard. You do go into services that actually put all their boundaries down and then say, well, you know, this child, young person, you know, has had a traumatic experience, and so they're going to do X, Y, or Z, and it can be quite unsafe. I've seen that firsthand in some of my services. So I think, I mean, it's probably a tough question for you, but some thoughts.
Yeah, no, and this is really where I'm at now. So
Mm,
I've probably spent the last 3, 4, 5 years of my career really embedding trauma-informed behaviour support practices, and not just with the work I do, but with training other staff. I've trained a couple of entire schools now, so all staff in those schools, to be able to support young people in a trauma-informed way, and updating whole school behaviour policies to include trauma-informed strategies. And I have had a lot of success with it in terms of developing great rapport with students, helping with the identification of their unmet needs and finding ways to meet those
yeah.
needs, de-escalating crises, and prevention of crises. But what I've started to notice, and it's not every student. There are some students that the trauma-informed support is enough that
Mm,
they start to feel like they belong, they start to feel good, they develop the relationships, and then they start to flourish. But there also are other students that I've noticed a pattern where the trauma-informed support can sort of look like it's an absence of boundaries. Because
yes.
essentially, what every training I've ever done in trauma-informed support would say is, if a young person is escalated, drop your task demands and co-regulate with them. Help them
Mm,
get back to baseline.
yeah.
So obviously, if over time, every time a young person gets escalated, we are taking away any kind of expectation and then helping and supporting them to regulate. Are we reinforcing those behaviours of concern? Because what I'm starting to suspect is that some young people learn over time that if they get escalated,
Mm,
the expectations will be dropped. Yeah. So I'm sort of thinking, how can we still uphold boundaries for our young people whilst maintaining our trauma-informed approach? And I've got a few theories on that, but I've actually never been to any training where they've had
mm.
that question adequately answered. And I've done a lot of different trainings, including some postgraduate studies at uni around this. And I'm still just seeing it as a gap. I guess for me, I think it's really important that we don't reward the negative behavior,
Mm.
but we still view the behavior with empathy, and we're still supportive, but there has to be some kind of way that we can be empathic, supportive, non-judgmental, but still hold firm on whatever the important boundary is in that moment. And that's where I'm really at in my sort of philosophical wonderings around behaviour support, because I would hate to be reinforcing behaviours of concern.
Yeah, that is, you're right that I've been on lots of training and deliver lots of training on this topic, and sometimes it comes up in a different way for me when I'm delivering the training, that staff really want a consequence, or a punishment for certain behaviours. And obviously that's not in line with trauma-informed approaches, apart from maybe more natural consequences and restorative approaches. So I've kind of heard it from that side, but I couldn't agree more of that being such a gap. And I think I work one-to-one and run therapeutic interventions with autistic individuals with the idea of helping to build confidence so they're able to access more learning in the special needs service that they work in. And the kind of, I mean, I've not had any specific training on exactly what you said, but I think it's more just my gut is around just maintaining those expectations. And maybe that's just me as a practitioner, where it's not someone's had a meltdown, I'm going to reduce everything and then never go back to that expectation. I think it might be in the moment, I've got to think about safety, and I'll address that those safety needs. But when it's right and I can see that someone's more regulated, we start to go back to the expectation. And I think that's worked really well for many of my pupils. Some really struggle still and are struggling to access curriculum, but some really that I think it's like that philosophy that you were talking about, that, and actually bravery sometimes. I don't know if you agree with that, where it's kind of frightening sometimes when you've got someone that could be physical and you're taking a punt to actually maintain a boundary and maintain some expectations. And I think it does take a bit of a level of bravery from staff to take that punt and maybe support as well.
Yeah. So, first of all, going to consequences, I would agree. I'm not a fan of consequences. I don't think there needs to be an additional consequence. But what I'm starting to think there needs to be is a firm boundary, regardless of what behaviour is presented. So let's say, for example, like if I wanted to eat 25 kilos of chocolate in a day, people would say that's not going to be good for you and you're not going to do it. Like if I was a child, my parents wouldn't let me do it, right?
Yeah.
And if I arced up, had an escalation, and started becoming violent, it would be a bad thing for that chocolate to be given to me to get me to stop doing what I was doing.
Yeah.
So it would be better. So I can see you're really upset, be supportive, use all your de-escalation strategies, but hold firm on the no, you're not having 25 kilos of chocolate today.
Yeah.
So I guess in our sort of work that I'm doing at the moment, we're seeing a lot of kids who, when we drop the expectation to try and help them regulate, and then we revisit the expectation later when they're regulated, they just go back into escalation. And it goes on, it can become this perpetual cycle of us dropping expectations, which in a way, I'm wondering, is it reinforcing the escalations that we're seeing and the behaviours of concern? And obviously every case is different. It might be time to do literacy, but the young person wants to play Minecraft on the iPad, but it's not free time or reward time. It's learning time. So we might say, sorry, it's not iPad time right now. And then we might have a big violent escalation ensue. The classroom might get trashed, people might get punched, etc. It's my belief that we should be calm, empathic, supportive, active, listen, validate emotions, de-escalate, but at no point will they get the iPad.
Yeah.
No matter what happens, they're not getting the iPad. Yeah? But how do we do that in practice if the young person escalates to such a point that there's extreme safety concerns? Because that's something that happens quite regularly, not just where I've worked over the course of my career, but when I speak to colleagues that work in education, it's quite common that they end up actually feeling like they have to relent for safety. So I guess this is the gap that I'm sort of looking at and thinking about. How can we uphold those boundaries? Because these incidents that I'm talking about are actually, they're not rare, they're quite common.
Yeah.
How do we uphold these boundaries whilst whilst maintaining a trauma-informed approach and being minimally restrictive, right? Because we don't want to use restrictive practices. We're all committed to eliminating them as much as possible. But once the escalation starts and the young person is acting in an incredibly unsafe manner, we invariably have to use some restrictive practices for safety reasons. Yeah. So, yeah.
It's such a tough one, isn't it? I'm really enjoying this chat because it's really getting my brain firing on all cylinders. And I don't think in a half an hour podcast, sadly, that we'll come up with all of the answers for the listener.
No.
And like you said off air, we're probably going to bring up more questions and answers. But this isn't uncommon what you're describing in my experience of going to the schools in the UK. And I think some schools might take an approach whereby short term, they might have a plan in place to maintain that boundary that we know causes an escalation, and actually have a positive handling plan in place that kind of accepts that we're going to get some pushback from it. But I think when you're taking that kind of approach, it's involving, parents and carers, it's involving like the whole staff team, so everyone's consistent with that boundary. And I think what can happen with trauma-informed approaches, if you've got one loose link really in implementing that boundary, it makes it incredibly difficult as a whole staff team to kind of go with that approach. And my experience is that if as a service we hold fast to that boundary, and although it can be a very challenging situation to cope with, it only happens a couple of times, and then the boundary is firm, the young person's pushing against it, but the boundary's firm. But it's so difficult because I'm thinking as a parent or carer, it's kind of about an iPad, isn't it? And it's and then
I mean, it's not about an iPad every time, but that's one example.
Yeah. And I just think, but that's similar to my service, where it would be about something very small, like, wanting to do X, Y, or Z, actually now we're doing this. And I think, it's so tricky, isn't it?
Yeah, because without the context of the bigger picture, if you're holding that boundary and the student's highly escalated and maybe not just trying to harm others, but maybe doing things that are putting themselves
Yeah.
in danger,
Yeah.
at what point do you call it? At what point do you say, okay, we can't hold this boundary anymore? Because it's really not about that you didn't want them to go on the iPad that day.
No,
It's
I
actually not
know.
about that.
Yeah.
What it's about is, do you want that young person to walk away from that situation knowing exactly what they have to do to get what they want every time? Because that's what I've seen happen. I've seen young people go, okay, so that's the line. That's where I have to go to get the staff trying to support me to give me what I want.
Yeah. And I suppose
So,
if I know that you're a team teach tutor as well, Haydn, and I suppose if I was going back to some of the values around the courses that we run, it would be going back to staff and thinking about the positive approaches that you put in beforehand, and kind of going back to that approach that I know firsthand, and I'm sure you do, that you can put every single thing in a program for a child or a young person, and you still will kind of get to there, because there's some such complexities. I think I've said that right.
yeah, absolutely. So all of that preventative stuff, all of that positive behavior planning, extra supports, extra sensory breaks, reward schedules, meeting of universal needs, all of that stuff's in place. And as I said, for some students, it's enough.
Yeah.
But there's others where I'm just noticing this trend of,
Yeah.
are we inadvertently reinforcing these negative behaviors? If we are, what can we do about it? And look, I've had some success with really holding firm on a few boundaries. I've had a couple of kids just make the most astonishing progress. Parents in at the school in tears of joy because their child is now coming home and demonstrating great progress. But I'm really in the infancy of trying to combine the trauma-informed approaches with some boundaries and expectations in some kind of cohesive way. I think a lot about resilience as well. So we know that resilience is an issue worldwide for young people at the moment. It's more of an issue than it's probably ever been. And we develop resilience by embracing and stepping through discomfort, by pushing through something that we find difficult, and then learning that we got to the other side and achieved it, even though it was just, uncomfortable and difficult for us at the time. Are we facilitating situations for our young people where they've got the opportunity to do that, where they've actually got the opportunity to step through that discomfort?
Brilliant, Haydn. I'm conscious of time. That time has absolutely flown by. But if you could just finish us off with 3 top tips, that would be great.
Yeah, my 3 top tips. Number 1 was to be curious. Look beneath the surface for all factors that may be contributing to a situation. So obviously, whatever the behaviour is that you're seeing, there's so many things happening underneath that behaviour for the young person. Not just for the young person, but what might be happening for the young person's parents, what might be happening for the staff member that's involved in the situation with the young person. There's so many layers that we need to try and understand about any moment in time. And if we don't do that and we just respond to the behaviour, we're likely going to miss the point. So we really got to take the time to try and unpack what's happening underneath. Understand. My tip number 2 was to understand all perspectives. Take the time to put yourself in other people's shoes. And in complex situations, that will be a lot of shoes. So I do a lot of complex case management. And again, there's the young person, there's the family, there might be some external therapists, there might be it's called Department of Communities over here if the young person's no longer in the care of their parents.
Yeah.
But there's a lot of different stakeholders in a complex case, and everyone's got a different perspective. And if we're going to help facilitate a positive outcome for the young person, we really need to try and understand all of those perspectives. And then finally, it's just to collaborate and be flexible. So true collaboration and synthesis of ideas often leads to the best results. In my experience, it is seldom the case that any approach will be a one-size-fits-all fix to a complex circumstance.
But absolutely, just that one size fits all. I gave a metaphor, I think, at the start of the podcast before we started recording, about being like in a sweet shop and just trying to find the appropriate pick a mix. For the individual. Yeah. That was so great, Haydn. So much in there and such a meaty topic to talk to you about. And I really appreciate your time.
Thanks for having me on, Claire. Lovely to speak with you.
You've been listening to the Team Teach podcast. It's been great to have you here with us as we discuss behaviour, communication, and the ways we can best support those in our care. Thanks again, and I'll see you next time.